Hi guys, you're welcome back to my broadcast. In today's video, I'll be talking about chemical pregnancy. So if you're a lady and you are above 35 years of age, pay attention to this video and watch it till the end because this issue of chemical pregnancy is very common amongst ladies from 35 years and above. At times, you will hear some ladies will say, I have my menstrual flow this month and it came for more than a week. Some others will be complaining. I had my menstrual flow this month and it lasted for more than 2 weeks. Some others will even complain. I had my menstrual flow this month and it came 2 weeks late. And others will complain. I had my menstrual flow this month and it flowed too much. Some others will even be complaining. I had my menstrual flow this month and it came and it was flowing with so much or with too much lumps. It came out in lumps. All these are things you have to pay attention to because at times these things, they don't just happen. They are not normal. Yeah, they might be normal to about 50% of the ladies, but when it concerns menstrual flow, it is not normal to every lady. So when you see things like this, it is always good to ask questions. It is always good to ask your doctor. Maybe go to your doctor and find out why abnormalities like that are occurring. So, what is chemical pregnancy? Chemical pregnancy is that pregnancy that lasted for just 5 weeks. And after that, you had a miscarriage. Or, in a simpler way, chemical pregnancy is a miscarriage that happens after 5 weeks of pregnancy. At times, when you see things like this, know that you are having a chemical pregnancy. Most ladies have experienced this. I know you, and they might not even know they are having or they were pregnant before, and they might not even know they are going through a chemical pregnancy because it is not a common term. It is not something that is common. And I believe most people might have heard about it, and many people might still not have heard about it. So if you are a lady, you are above 35 years, you have been having this issue of so much menstrual flow, it is not coming on time, or it's flowing in an abnormal way, know that you might be going through a chemical pregnancy. So what are the causes of a chemical pregnancy? At times, this can happen because you have an infection. Yeah, a chemical pregnancy can happen because you are having an infection. Things like chlamydia and syphilis or even gonorrhea can make you to have this or can be the cause of a chemical pregnancy. I believe most of us, we know what chlamydia, syphilis or gonorrhea is. There are sexually transmitted infections that at times can cause issues in your system. So, one of the main cause of a chemical pregnancy can be infection, which can be chlamydia, syphilis, or gonorrhea. Another cause of a chemical pregnancy can be implantation outside the uterus. That is, the implantation did not occur in the uterus but outside the uterus. And when this happens, you will always have an issue. It might lead to chemical pregnancy. So it is always good from time to time to go for a checkup. Or if you see things like this, if you realize that there are some abnormalities with your menstrual flow, it is always good to seek the help of your doctor. It can also happen because of uterine abnormalities. Yeah, some women go through a lot. So it can happen because of uterine abnormalities. Another cause is abnormal hormonal level. Some women have this issue of hormonal imbalance. So when you are having this issue of hormonal imbalance, it can be one of the causes why you are having a chemical pregnancy. And it should be noted that chemical pregnancy is not something that is not common. It is common. It is very common. But because most people don't know about it, you just think that maybe I'm having my menstrual flow this month and it is coming out, or it is flowing very much, or it takes time. It takes about 2 weeks to flow. So they don't pay attention. They think it's normal. After all, you're having your menstrual flow, you are not pregnant, so you are not worried about it. But you can keep on losing pregnancies upon pregnancies if you do not go to your doctor and then look for the cause of this issue. So at times when you are having this issue, please visit your doctor, because chemical pregnancy can happen to you even 10 times without you knowing. It can happen and happen and happen without you knowing. And at times this can lead to another issue which can be dangerous. So it is always good to consult a doctor when you realize that your menstrual flow is not okay, or when you realize some abnormalities with your menstrual flow. Yeah, now let's go to the symptoms. When you are having a chemical pregnancy, as I mentioned earlier, you will have things like late periods. For example, if you were supposed to have your menstrual flow on the 15th, it might come on the 30th. And you will think, it came. There is no issue. I don't have to worry about anything. So when you are somebody who keeps having this late menstrual flow, please, you have to check it up. You have to do a checkup. You have to check your system. I know it is very normal for some women to have a late menstrual flow, but when it is constant, then you have to check with your doctor. Another thing, another symptom is like heavy menstrual flow. If you are somebody, you have been having your menstrual flow and it is not that heavy, you realize that suddenly it becomes too heavy, please check with your doctor. And most ladies, when you go to their doctor, or if you are opportune, if you know about chemical pregnancy and you go to your doctor, the pregnancy test will be positive, but you are having your menstrual flow. This is because you are going through a chemical pregnancy. So if you are having a heavy menstrual flow and you have never observed it before, please check with your doctor. Don't just sit and say, after all, I'm having my menstrual flow, it is okay. No, check with your doctor. Another symptom that you can have when you are having a chemical pregnancy is that the bleeding will last for more than a week, at times for more than 2 weeks. Yes, the bleeding lasts for long. It will not be just normal like 5-6 days as you are always having with your other pregnancies, with your other menstrual flow. It will take a longer time. Another symptom you have to pay attention to is like your menstrual flow be coming out in clumps, or I call it lumps. You're coming out in lumps. You understand what I mean? When you see this, know that everything is not right. If you are somebody, you can just do a pregnancy test. You can just get the strip. You can get it in any store or in any pharmacy. You just do a pregnancy test. And if you realize that you are pregnant, go see your doctor so that your doctor can know the cause, or your doctor can know the reason why you are having a chemical pregnancy. And it should be noted that not every woman above the age of 35 has gone through a chemical pregnancy. But there are people, or there are some ladies that have a high risk of going through a chemical pregnancy, especially women who are trying to get pregnant through an IVF. I believe everybody knows what an IVF is. If you don't know, maybe you check it, you Google it. But it happens most of the times to women who are trying to get pregnant through IVF. Another group of women that are at risk of having this issue of chemical pregnancy are women who are above the age of 35. I believe you understand that when you are above the age of 35, it becomes a little bit difficult to get pregnant. A little bit difficult, not difficult. It becomes a little bit difficult. So if you are above the age of 35, that is why it is always good to pay attention to your body when you are above the age of 35, because you are at risk of having so many issues with your system. Another risks, or another people who are on a higher risk of having this chemical pregnancy are people who are suffering from thyroid disorder. Yeah, thyroid disorder. If you have a history or you have a medical history of a thyroid disorder, you are at risk of going through a chemical pregnancy. A chemical pregnancy is not something that is very common, as I said earlier before, but people are going through it every day and they don't even know that they have been through it, because you have your monthly flow but you have lost a baby. So it is always good to check on yourself, to visit your doctor when you realize that you are having your menstrual flow and there are some abnormalities. When there are some abnormalities, you might be going through a chemical pregnancy. I know it is a very strange word, but it exists. It happens. So please check on yourself, because chemical pregnancy can lead to something more dangerous. And it doesn't mean that because you have had a chemical pregnancy, you cannot get pregnant. No, you can still get pregnant. But to be on the safe side, it is always good when you are having or you are seeing some abnormalities to talk to your doctor. Thank you for listening to me. Don't forget to share this video. Don't forget to like. Don't forget to comment. See you on my next video. Thank you. Bye.